Some nursing mothers are excited that they are now able to vaccinate their children against the 6 childhood killer diseases. That's Joy News' observation when the news team visited the child welfare clinics at the Drabaka Polyclinic in Accra. Monday morning, oral polio vaccine, measles and BCG, which were in short supply for months, are now available at health facilities for child immunization.
It's a little over 9 a.m. here at the Adabraka Polyclinic, and there's excitement because the public health nurse here tells me that about 15 parents, 15 mothers, I should say, have been here already to vaccinate their children against any of the 6 childhood killer diseases. Prior to, we all know that we had in short supply these vaccines. Today, they are here, and this mother, Mamiesi, who has just vaccinated her child, is overly excited that she could get the vaccine for her child. She, however, had a caution for government. Now, Obano waji ni vaccines niya.
Mpachai.
Now, uti sena vaccines they be a shorty. Sena ma ofili ena sisi ya tise ni nyaba inti mothers mbuti miabe cha vaccines ni nyama mba sena ofili.
Oh, sisi ade jenya sisi biaba. First day ne bi no de ne high pa. Ne high pa because onwana ya di boy ba ho ban. Sisi ne biaba de nyam na eda na spa.
The public health nurse here at this clinic, Patricia, is urging parents to come over. This is where you will come, meet the nurses here. They are ready to vaccinate your children. Please, she says that everyone should bring their children. I have seen the vaccines, those against polio, those against measles, those against BCG. Just come. She says that all the vaccines are here. They were delivered this morning. And so she's urging every parent who missed it due to the shortage or missed it due to 1 or 2 reasons, just come over here to the Adabraka Polyclinic or any other facility that your child can be vaccinated, so you get that done.
We are all excited anyway, since we need the welfare of the kids. So we will urge all mothers to actually walking into all or any nearby facility around them to take their vaccines.
Do you have all the vaccines you need now for the children?
Yes, please. We have all.
Which ones have you taken delivery of since yesterday till this morning?
Probably all that, those that we weren't having earlier, we've received everything. This very morning, we've received everything, yes.
Would you say you have the quantities that you need for the masses that will troop in?
Yes, please. For that one day, we do. Oh, actually, as earlier on, as I said, we are all urging all mothers around to just take the opportunity and then troop in, especially those who weren't able to get their previous vaccines. All those that are there, please, we urge them to join any facility around them nearby and then take their vaccines, just to protect their kids also.
Now we are heading over to the Mamobi Polyclinic, where today is actually a child welfare clinic, to ascertain the situation also there.
Let's go live to some health facilities for updates. My colleague Hannah Dame is stationed there for us. Hannah, where have you been since morning, and what can you report from where you are?
Hi. Hello, Aisha. I'm currently at the Mamobi Polyclinic, where we can see a lot of the mothers. They have come because some of them heard on the media, some of them through their friends also, that the vaccines are in. We knew the BCG, the measles, and the polio vaccines were in short, but today they are all here in their numbers. They are excited. I've been speaking to a lot of them who say that they do not want this to ever happen again. Why? Because they were in a state of anxiety. Now, I have with me here the public health nurse for this particular facility, Awo, and she has a massive campaign ongoing to get the mothers to come because she doesn't want any of them to miss the vaccination for their children. So let's speak to her. How are you? Welcome to Joy News. So you were telling me earlier how you intend to get the mothers to come over. Tell me more.
So we told the mothers, normally whenever they come for CWC, we give them next appointment. So those who missed their vaccines, we're expecting to get them next month. But immediately the polio vaccine arrived, we told the mothers around to sensitize them that the vaccines are in. Some of them to heard from the social media, so they've started coming to collect their polio vaccines.
And you must be excited because then you were telling me earlier how you were also equally worried with the shortage.
Yeah. we are very, very excited because as the babies are getting the polio vaccine, that means their protection is complete.
And she is Awo Pokwa. She's the public health nurse here at the Mamobi Polyclinic. We were earlier at the Adabaka Polyclinic where the nurses also told us that lots of the mothers had earlier come there to vaccinate their children. So as we can see, they are trooping in, and hopefully those who missed out will at least get their shots. Aisha.
With those updates from the Mamobi Clinic, various health facilities across the country have also received, have had delivery of their shots, and they are excited about it. The Volta Region Health Director, Dr. Sena Nojokoto, is among the several recipients. Listen to him.
The Director General gave us an order to ensure that all our cold vans are in Accra on Saturday, so that immediately the vaccines start basing in the country, we are able to pick it and distribute it to the rest of the regions. So we did exactly the same, and the process is ongoing in the Volta region. We are hoping that sometime during the day, all the facilities will have vaccines. So we've received vaccines that will be adequate enough to do the catch-up vaccination, and also last us for the next 6 weeks. We are made to understand, and we believe so, that within the next couple of weeks we'll get vaccines in adequate supply to take care of the rest of the year. We are telling you that by close of day, we should have all the vaccines in the various facilities. So today I've engaged quite a number of radio stations in the Volta region, and we've engaged our system that latest tomorrow morning, everybody who requires the vaccine should have it available. We know the needs for the various districts, and we know the gaps, and we distributed it accordingly. So we know that at least for the next 4 to 6 weeks, we are in the position to provide the services that